Okay, so we're going to start by going over the first set of PowerPoints, PowerPoint 1 for Chapter 6. And the PowerPoints first begin by looking at the functions of bone tissue, and you should already know these from Chapter 1. Support, protection, movement, all these are functions of bones. Just as a reminder, also, storage of minerals is another of the functions of bone. Storage of fat. It's another one of the functions of bone. Okay, fat is storage, which takes place in the marrow of bones. Okay, let me get this thing going. Okay, nope. Okay, give me a second. My little pen is not working. Okay, there we go. All right, so a storage of minerals like calcium, phosphate minerals. Yellow marrow is a storage of fat. This is important blood cell formation. We talked about it. It's called hematopoiesis. So that would be another function of bone. So let's start just by reviewing the functions of bone tissue. Then the components of the skeletal system, those would be bone itself. Okay, we should expect that. So the bones themselves, then we have cartilage, hyaline cartilage, and fibrocartilage. Notice that elastic cartilage is not part of the group because it doesn't have anything to do with bone. So hyaline cartilage, fibrocartilage, then ligaments, which connect bone to bone. Tendons are connecting muscle to bone. So they're not technically part of the skeletal system, but they're mentioned because they do connect bone to muscle. And when it comes to cartilage, remember that cartilage is connective tissue. So it's going to have two components. One of the components will be cells. The other component is going to be the matrix. In the case of cells, the cells are going to be chondrocytes and chondroblasts. Chondroblasts are the young cells of cartilage. Remember, chondro meant cartilage, and chondrocytes are going to be the mature cells of cartilage. The matrix of cartilage is a semi-solid matrix. And a semi-solid matrix is going to need a lacunae for these cells to live in. So the semi-solid matrix will have lacunae where these chondrocytes are going to live. So that is the composition of the cartilage, like hyaline cartilage that is found in skeletal, associated with bones, with the skeletal system. Perichondrium is the membrane that covers the outside surface of cartilage. And this picture right here is a great picture of hyaline cartilage at the end of a long bone. So this white surface right here is called, the structure is called articular cartilage. Articular cartilage is found at the end of long bones where the bone articulates with other bones. The tissue that makes articular cartilage is hyaline cartilage. So don't confuse or get straight the tissue or the fabric makes up the structure. The structure is articular cartilage, the tissue is hyaline cartilage. So hyaline cartilage is associated with bone, is found in articular cartilage, is found at the end of ribs, then we call it costal cartilage. The other cartilage associated with bone was fibrocartilage. And fibrocartilage is similar to hyaline cartilage, is that it does have collagen fibers, just like hyaline cartilage has, but it has more of them, creating a more tensile, more stronger type of tissue that is able to withstand shock. The fibrocartilage is found in the pubic symphysis, the menisci of the knees, and intervertebral discs. So you should know where this location of this cartilage is, especially fibrocartilage found in only 3 places: pubic symphysis, menisces of the knees, and the intervertebral discs right there. Hyaline cartilage associated with bone will be found in articular cartilage at the end of long bones, costal cartilage at the end of ribs. Cartilage does grow during childhood and adolescence. The growth of cartilage is called a positional growth when it comes to when it pertains to the thickness growing outwards. When it pertains to it growing in length, it's called interstitial growth. However, cartilage does calcify as we grow older, and calcification of cartilage will end the growth of bone, for example. Okay, again, ligaments are the tissue that binds bone to bone. Tendons bind muscle to bone. So those will be the component skeletal system. Now, the most obvious, most important component of the skeletal system is going to be the bones themselves. So we need to spend a lot of time looking at the bones themselves. Now, bone is connective tissue. And as we have already said several times, connective tissue is made of two components, cells and matrix. In the case of bone, the cells that we're going to find in bone tissue are going to be osteoprogenitor cells, which are going to be stem cells. And osteoprogenitor cells are constantly dividing, and some of the daughter cells are going to turn into osteoblasts. So osteoblasts are going to be young bone cells. Blast meant young. These cells are secreting the matrix of the bone. As they do that, they eventually become trapped in matrix. When they become trapped in the matrix, they mature into an osteocyte. So this progression from osteoprogenitor to osteocyte gives us the mature cell, osteocyte, which is the one that is found inside the bone matrix, trapped in the lacunae, trapped in the matrix. The other cell found in bone tissue has nothing to do with this family of cells. It belongs to a different family altogether. It's called an osteoclast. So it belongs to a different clan of cells. Now, the matrix of bone tissue is very different in that it has three components instead of two. So it does have a ground substance, just like all connective tissue. And ground substance is made of proteins and proteoglycans. It has protein fibers, which is essentially collagen fibers. And then it has a third component, which is unique to bone tissue, and that is the calcium phosphate crystals, also called hydroxyapatite crystals. Okay, so that's going to say crystals there. All right, now the two components are different in that the ground substance and the protein fibers are organic. They're made of proteins and carbohydrates. Organic substances can only be made by cells. So osteoblasts are in charge of secreting and making these organic components of the matrix. They're secreting and making the ground substance and the protein fibers. Osteocytes maintain, once it's made, they maintain this organic component of the bone matrix. The organic component of the bone matrix is called the osteoid. So there are a lot of osteo words in this chapter that have to be kept straight. The osteoid is the organic component of the bone matrix. The ground substance and the protein fibers. Now, the calcium phosphate crystals are inorganic, and it cannot be made by cells. It has to be eaten, so we get it from the food. So you should be able to distinguish between the inorganic component of the bone matrix and the organic component of the bone matrix secreted by the osteoblasts, and is called the osteoid. So those are the three components of the bone matrix. Here's the inorganic component, the calcium phosphate hydroxyapatite crystals, which actually made most of the bone matrix, 65% of the bone matrix. The organic component right here is called the osteoid and is made of the ground substance and the protein collagen fibers. So the organic components are synthesized, which is the osteoid, are synthesized by osteoblasts. The inorganic component is ingested from food with the help of vitamin D, deposited into the blood, from the blood into the bones, and it is the osteoblast help in processing these inorganic component into the bone. So again, 65% of bone matrix is going to be inorganic, 35% organic. And you definitely need to know what happens to bone if one of those components is missing. So healthy bone tissue should have both components. If the calcium phosphate is missing, now we have a bone that is essentially leather. Collagen is leather. Leather is made of collagen. So we have a soft tissue. So if the calcium is missing, now we have soft bones. On the other hand, if the leather part is missing, if the collagen is missing, now we have bones that cannot withstand pressure. Instead of bending with pressure, they shatter. So we have brittle bones. So don't have calcium, we end up with bendable bones. We have no collagen, we end up with brittle bones. You should definitely know what happens when we lack one component or another. So healthy bone should have both components. So let's go over these cells that we find in bone tissue. And notice that this is bone right here. So this right here will be the surface of the bone. And at the surface of the bone, we're going to have the osteoblasts and the osteoprogenitor cells. The osteoclasts here. The osteoprogenitor cells will also be found in this area, and these are typically large cells. So this will be an osteoprogenitor cell. And the osteoprogenitor cells are constantly dividing, and some of the daughter cells are going to differentiate into osteoblasts. Osteoblasts are cells that are going to produce the osteoid of the bone matrix, collagen and ground substance. They also allowed for deposits of calcium phosphate hydroxyapatite crystals onto the matrix. So these little cells are going to make the collagen fibers, and they're going to allow for the deposits of calcium among the collagen fibers. So pretty soon these little osteoblasts are going to be completely trapped in matrix. When these cells are trapped by the matrix, they mature into an osteocyte. So osteoblasts mature into osteocytes. So these are osteocytes trapped in the matrix, and notice that they have these extensions of their cytoplasm that travel through little canals in the matrix, and they communicate with each other via these extensions of their cytoplasm. The canals through which they extend their cytoplasm are called canaliculi. And what happens is some of these cells are closer to blood vessels than others. And those that are closer to the blood vessels have easy access to oxygen and nutrients. So they take in the nutrients and the oxygen and they pass it along to the cells that are farther away, trying to keep them all alive. So the canalicula is important in keeping the cells in deep bone tissue alive. Osteoclast on the other side. Let me go back to the first PowerPoint here and show you the little osteoclast. This is an osteoclast right here, which is actually a large cell found on the surface of bone tissue. This is a very different cell. Notice that it's multinucleated. It's huge, and then it has a ruffled surface against the bone tissue. This looks a lot like a macrophage, like one of those immune system cells that eat up other things, that eat up things. And it's probably derived from a macrophage anyway during development. Osteoclasts are going to be in charge of breaking down bone matrix, and the process is called osteolysis, and they are going to secrete this broken down matrix into the blood. So these cells are going to be reshaping bone and releasing this calcium into the blood. They are going to break down bone by releasing digestive enzymes. So from the ruffle border, the cells are secreting digestive enzymes, are powerful enzymes that dissolve the matrix, and they take in the matrix and secrete it out into blood. So you should definitely know the types of cells found in bone: osteoprogenitor cells, osteoblasts, right here, osteoclasts, and then osteocytes. Remember that osteoprogenitors, osteoblasts, osteocytes belong to the same family of cells, while osteoclasts, which are not here, osteoclasts, belong to a completely different type of cell. You should know that osteoblasts make bone tissue. Osteoclasts are the outside clan that break down bone tissue, bone matrix. Okay. All right, so what we're going to do next is we're going to look at bone tissue, the actual histology of the bone tissue, what it looks like and what it's made of. And bone tissue is organized into, before we go into that, sorry. All right, bone tissue is live tissue. So it's constantly being maintained, remade. All bone matrix is removed, new bone matrix is put down. So as this tissue is being remade, the immature, unfinished bone is called woven bone. So woven bone is seen during development, fetal development, and if there is a breaking in the bone, when the bone is repairing, the unfinished bone is called woven bone. Once the bone is finished by a process called remodeling, and that will give us lamellar bone. Remodeling means the removal of the old bone and adding new bone, or the changing of woven bone into mature lamellar bone. So keep in mind, bone tissue is active, is live tissue, which means that we need components to keep the tissue healthy throughout our entire lives. So we're going to need calcium our entire lives, and vitamin C to make collagen, etc. So lamellar bone is the mature, organized bone. Okay. The sheets of matrix are called lamellae. And compact bone, lamellar bone, is organized into columns which are concentric to each other. So these tubes, one inside the other, that are going to have the collagen fibers positioned at 180-degree angles from each other. So if the outside column has collagen fibers going in one direction, the inside column will have them going in the opposite direction, and vice versa. And that allows for twisting of the bone. There are two organizations of bone tissue. We have what we call compact bone, which is a strong, dense bone that is able to withstand stress in one direction, and the spongy or cancellous bone, which stands stress from different directions. I will look at a spongy or cancellous bone first. And a spongy or cancellous bone is made by these plates of lamellae going in the direction of a stress. So these plates of lamellae are called trabeculae. And this information is especially important for lab. You should be able to identify trabeculae. The spaces between trabeculae are going to be filled with marrow and will be lined with a membrane called the endosteum. So the endosteum is the membrane that covers the inside of these spaces. The spaces are filled with marrow. So you have this spongy looking bone, that's where the name comes in. And this kind of bone will be found in the middle of a flat bone, for example, sandwiched between two layers of compact bone. You still are going to have osteocytes in the matrix. You're still going to have canaliculi. You're going to have the large osteoclast, the osteoblast on the surface, etc. Spongy bone is also found at the end of long bones in areas where there is pressure coming in from different directions. And then as you move into the shaft of the bone, you can see compact bone being formed on the shaft. So compact bone is a lot more interesting, it's a lot more complex. First of all, compact bone is found in the shaft of long bones. It is made by structures, columns called osteons. So the osteons are these columns right here that make up compact bone. Another name for these columns are Haversian systems. And the column is going to be in the direction of the shaft of the bone, the length of the bone. So imagine a building and you have columns to give the building support in the direction of the weight of the length of the building. Okay, so the components of the osteon, again, lots of osteo words. Just a second, let me go back to the first. Yeah, okay. So the components of the osteon are going to be the plates of matrix are going to be called concentric lamellae. And this concentric lamellae is going to be formed around a central canal right there. So we have concentric lamellae formed around a central canal. In the central canal, we're going to find blood vessels and nerves. So there's a central canal right here. There's a central canal, Okay. Within the matrix, we're going to see lacunae with little osteocytes inside and canaliculi. So lacunae with the little osteocytes living inside and canaliculi. So this is an osteon. Do not confuse osteon, which are the columns that we see in compact bone, with osteoid, which is the organic component of the matrix of bone tissue. Okay. Now, when you look at a compact bone, you can see the osteons right here, and another one here, and another one here, and another one, and another one. Now, also notice there is another type of matrix on the outside of the bone, on the perimeter of the bone, going all around right there. Okay. Those plates of matrix are going to be called circumferential lamellae because they are going on the circumference of the bone tissue. So circumferential lamellae right here. Remember, the lamellae of the osteon was called concentric because it's in concentric circles. The lamellae that is on the perimeter of the bone is called circumferential lamellae. And then there is yet another lamellae. In between osteons, there are the remnants of old osteons. Again, bone tissue is active. Old osteons are going to be destroyed. New osteons are going to be made. What remains of the old osteons is going to be interstitial lamellae. Okay. So you should definitely know the kinds of lamellae that we find in compact bone, especially also for lab. In lab, we have a model of compact bone, and you should be able to identify all these components: the osteon, the concentric lamellae, the circumferential lamellae, interstitial lamellae, central canal, little osteocytes, canaliculi. Notice the central canal here, and notice these other canals going across from the central canal. Those are called perforating canals or Borgmann's canals. Again, you should be able to identify those. These canals are going to bring blood to deeper parts of the tissue. Also notice the periosteum right here, which is connected to the bone via these fibers called perforating or Sharpey's fibers. Again, that's part of the terms you need to know for lab. These are the three types of lamellae that we find. Okay, so that is the microscopic uh, uh, anatomy of bone tissue. And now we're going to look at gross anatomy of bone. So we're going to look at the macroscopic shapes of bones. And we can classify bones according to their shapes. So we have long bones, short bones, flat bones, irregular bones. We saw these in lab also. So you should be able to identify examples of a flat bone, which is a bone that is flat and it's typically curved. All of the bones of the skull up here, the parietal, the frontal, the occipital, the temporal, are considered flat bones. Long bones are the bones of the limbs. So the humerus, the ulna, the radius, the phalanges, the metacarpals are all long bones. The femur, the tibia, the fibula, the metatarsals, the phalanges are all long bones. Short bones are square little bones that are found in the wrist or in the tarsal bones. So the talus would be a short bone. In the wrist, all of the wrist bones, the scaphoid, the lunate, the trapezoid are all short bones. Irregular bones are bones that don't fit into any of the other categories. The vertebra are considered irregular bones. Also, all of the bones of the face are considered irregular. So the sphenoid, the zygomatic, the mandible, the maxilla, ethmoid, all of those bones are considered irregular bones. So again, just know the classification and identify examples of each. The next material can get a little confused, students. And what this is it's a look at a long bone, at the gross anatomy of a long bone. Again, we're looking at it without the help of a microscope. And now we're going to identify the parts of a long bone. Okay, so if you have a long bone, let me make a little long bone here, kind of like a femur. Okay, so that's a long bone right there. Notice that the long bone is going to have a shaft right here in the middle, except we're not going to call it a shaft, we call it a diaphysis. So this is the place where we're going to find compact bone. We're going to have osteons. There's going to be a marrow cavity in the middle, which is going to have yellow bone marrow, especially in the case of adult bones. And then we have the two ends of the bone. We have one end here, another end over here. These are called the epiphyses of the bone. We have a proximal epiphysis closer to the trunk and a distal epiphysis farther from the trunk. Inside, there's going to be a spongy tissue. And if the bone is still growing, the epiphyseal plate or growth plate would be at the epiphysis. If the bone has finished growing, then there will be an epiphyseal line or no, just a growth line. So epiphyseal plate is found, plates that are in bones that are still growing, like this one right here. And the epiphyseal plate is made of hyaline cartilage, will be replaced with a bone tissue and epiphyseal line once the bone finishes. Inside the medullary cavity, there will be marrow, and it could either be yellow marrow in the case of adult bones. Medullary cavity will have yellow marrow. In some places, however, in children, and then as adults, in some of the bones, will have red marrow, which is hematopoietic tissue. In adults, hematopoietic tissue is replaced with yellow marrow in most bones. In adults, the bones that keep red marrow are going to be bones like the sternum, the body of the vertebra, the proximal epiphysis of the humerus and the femur. The pelvic bone is another one. So there's a PowerPoint that gives you this information. And you do definitely have to know which bones still have red marrow in adults. Again, definitely be able to identify the parts of a long bone. The distal epiphysis, proximal epiphysis, diaphysis, an epiphyseal line or plate, spongy tissue in the epiphysis, compact bone tissue in the diaphysis, articular cartilage at the end of the epiphysis. Also give me a second, the periosteum, which is the membrane that covers the outside of the bone, right there. Osteoblasts and osteoclasts and osteoprogenitor cells are going to be found wedged between periosteum and bone tissue, right there. Okay. Again, Sharpey's fiber, the fibers that connect periosteum to bone tissue. Give me just a minute. I'm going to run, let my dog out, and I'll be right back. Okay, I'm back. All right, so let's review flat bones. Flat bones, again, have a spongy tissue in the middle and compact bone on either side. And again, flat bones, nice parietal bone right here with the nice spongy tissue in the middle. This is an irregular bone, is spongy tissue on the body of the vertebra, compact bone surrounding it so that the bone on the outside always looks smooth. And if you were to break any of the processes, you will see a spongy bone on the inside. So you should have an idea of where we find spongy bone and compact bone. Okay, and definitely make sure you can identify the parts of a long bone. Okay. Any questions? We've finished with the first set of PowerPoints. We still have time, so we can go ahead and move on to the second set. Okay. Okay, so the second set of PowerPoints is going to look at bone development. And bone development is referred to as osteogenesis, and it happens early in development. It happens between 8 and 9 weeks of development. 8 weeks is the last week in which the embryo is being developed. 9 weeks is then we call him fetus. So 8 to 9 weeks is the interface between embryonic life and fetal life. So this development of bones happens late in embryonic life, early in fetal life, between 8 and 9 weeks of development. So again, there are two mechanisms, intramembranous ossification and endochondral ossification. Intramembranous ossification is going to use a soft connective tissue that will be ossified. And we're going to both in just a second. The bones made by intramembranous ossification will be different from the bones made by endochondral ossification. Endochondral ossification is going to use hyaline cartilage to make bone. So we're going to compare and contrast both mechanisms. Intramembranous ossification, again, is going to create bone from soft connective tissue. It is described here as fibrous membranous embryonic connective tissue. Think of it as mesenchymal tissue. You can also think of it as dense, irregular connective tissue. That's what it looks like. So if you picture the tissue of the dermis, that's what this tissue is going to look like. That is going to be turned into bone tissue. As a matter of fact, the bones made by intramembranous ossification are oftentimes called dermal bones because they came from tissue that looked like the dermis of the skin. On the other hand, endochondral ossification is going to come from hyaline cartilage. The immature bone is going to be called woven bone, which will need to be mature and remodeled. So again, remodeling involves the removal of old bone, adding new one, or the change of immature bone into mature lamellar bone. Okay, So intramembranous ossification is going to make most of the skull bones, parts of the mandible, and the shaft of the clavicles, the diaphysis of the clavicles. By the time of birth, intramembranous ossification has not ended. It's still going on. So when you touch a newborn's head, you'll feel soft spots called fontanelles, which are the areas where intramembranous ossification is still taking place. It will typically end between 1 and 2 years of age. At that point, the fontanelles close. Intramembranous ossification starts from what's called an ossification center, and it moves from that ossification center outwards to create a bone. So it's going to begin by the accumulation or the congregation of fibroblasts. So these little mesenchymal cells, which are essentially fibroblasts, are all going to come together in one area, congregate, and then they're going to differentiate into osteoblasts. They begin to secrete lots of collagen fibers, and that allows for the deposition of calcium. So this will begin to calcify. Okay. Pretty soon, some of these cells have been trapped into a calcified matrix, and now they're called osteocytes. The ones in the periphery continue to secrete bone matrix and continue to ossify the tissue as they calcify it. In the process, blood vessels are trapped, and notice that a spongy bone tissue is being created. Also notice that at the periphery of the bone tissue, fibroblasts begin to congregate again, and they align with the direction of the bone tissue. These fibroblasts are now going to create the periosteum. So later on, you're going to have the little fibroblasts creating the periosteum. You have osteoclasts still working away, creating more bone tissue. You have a spongy tissue in the middle and plate of compact bone tissue on either side. So that's what intramembranous ossification looks like as it is making the bones of the cranium, mandible, maxilla, etc. Again, this is made from mesenchymal soft connective tissue, and it will not end until 1 to 2 years after birth. Endochondral ossification, on the other hand, is going to start out with a hyaline cartilage of model of the bone, which will be ossified. Bones that are made by this mechanism is going to be pretty much all of the long bones, bones at the base of the skull, parts of the mandible, the epiphysis of the clavicles. So really, when you think of endochondral ossification, you should think of long bones. The process continues on throughout life until about after puberty, 18 to 20 years of age, when the growth of the length of long bones ceases. So endochondral ossification begins again at about 9 weeks of development. We have a hyaline cartilage of the long bone that has been formed, and calcification begins in the center of that model of cartilage, and there's also calcification going on at the collar of the cartilage. The calcification is important because what it's going to do is it's going to kill the chondrocytes in the cartilage. Remember, hyaline cartilage doesn't have blood vessels, so these cells are relying on diffusion of oxygen and nutrients to keep themselves alive. If all of a sudden there's a calcified tissue on either side of these model, now there will be no diffusion into the tissue, into the hyaline cartilage, and the cells in the cartilage cannot get oxygen or nutrients, and they begin to die. Calcification in the center also kills some of the cells, and pretty soon you're going to have now little dead cells with empty lacunae all over. Okay. Next thing that happens, and that at about the 3rd month in development, is that blood vessels begin to enter this calcified tissue. Now this is 3rd month in the fetal life. That means the blood is going to carry stem cells, it's going to carry osteoblasts, it's going to carry cells that will turn into osteoclasts. So these cells begin to set house inside this calcified matrix. Osteoblasts begin to secrete more collagen fibers, which allows for more calcification. Osteoclasts begin to eat up the center of this model, creating a marrow cavity where hematopoietic tissue brought in by the blood can set house. So now this is birth. You have the diaphysis of the bone, already pretty calcified, but still needs some more, calcification. But then you have secondary centers of ossification taking place in the epiphysis on either epiphysis of the long bone. These centers have already been invaded by blood vessels, so that during childhood and adolescence, what we're going to have is the epiphysis of the bone separated from the diaphysis of the bone by a plate of cartilage called the epiphyseal plate or growth plate. Same here, the distal epiphysis would be separated from the diaphysis by another plate of cartilage. The articular cartilage on the outside, right here, is the hyaline cartilage that is covering the ends of the both epiphyseal ends. So this continues on from newborn into childhood and adolescence, and as the child grows, the bone grows in the direction of the epiphysis, and so does the cartilage. So bone growth follows cartilage growth, and the bone grows in length as the process continues. In adolescence, however, secretion of sex hormones, testosterone and estrogen, is going to stimulate osteoblast activity and is going to stimulate bone growth so much that the bone will begin to overtake the cartilage. The cartilage cannot keep up, and eventually the whole plate will be ossified, ending up with an epiphyseal line, which represents the end of the growth of the bone. This is a little fetus here, and you can see the growth plates right there as these soft tissue separating the bone tissue that is being formed. Another form of bone growth continues throughout life. This is called appositional growth. And appositional growth refers to the thickness, the growth in thickness of the bone and the remodeling of the bone. So as we use bones in different manners, the bones that are used more are going to become thicker than the bones that are used less. So you can imagine a pitcher, for example, will have a thicker bone on the pitch arm than it would on the other arm. That growth in thickness that can happen throughout life is called appositional growth. If we break a bone, the bone has to be repaired, and that part of the repair will be due to appositional growth. So here's a depiction of appositional growth, and what you see here, there's the little osteoblasts. Now, osteoblasts respond to mechanical stress. So mechanical stress can be exercise, for example. So as we're using the bone more and more, the mechanical stress created stimulates osteoblasts, and osteoblast grows in the direction of this mechanical stress, becoming thicker and eventually creating bone tissue, so the bone now has thickened. That's what we call appositional growth. Appositional growth occurs throughout life. Interstitial growth, on the other hand, refers to the growth in length of the bone that takes place at the epiphyseal plate. This kind of process ends between 12 and 25 years of age, depending on the sex and depending on the gender, on the, genetics. The articular cartilage is found at the end of the epiphysis, and hopefully that never ossifies if we're lucky. All right, so this is a depiction of what happens at the epiphyseal plate. Down here we have a calcification zone. So these are the area that in which bone tissue is growing and calcifying the cartilage ahead of it. This is an area where the cartilage is beginning to be calcified, so the cells are beginning to die. You can see some empty lacunae. This is the area of healthy cartilage, the proliferation zone from which the cartilage is growing, and cartilage continues to grow outward with bone calcifying it from behind. So the whole process continues throughout the growth period. During adolescence, that's when the beginning of the end happens because estrogen and testosterone is going to stimulate the activity of osteoblasts more so, and osteoblasts will be stimulated, grow faster, calcification will begin to overtake the cartilage. Cartilage cannot keep up and eventually completely ossifies. So remember, osteogenesis is the development of growth it starts before birth and ends 1 to 2 years after birth in the case of intramembranous ossification, or goes all the way until early adulthood into endochondral ossification. Bone growth after birth, interstitial growth, is what happens in endochondral ossification as the bones grow in length. Appositional growth is the growth in thickness, which continues throughout life. Okay, so bone growth is dependent on nutrients like calcium and protein, which is needed to make collagen. Vitamins are needed. Vitamin D is very important because vitamin D is needed in the absorption of calcium from the intestines. So if we don't have enough vitamin D, now we're going to have soft bones. In children, the condition is called rickets. In adults, the condition is called osteomalacia. As we age, we secrete less vitamin D. So osteomalacia is common in elderly patients. Aside from vitamin D, we also need vitamin C. Think of C for collagen, because vitamin C is needed for the production of collagen. Scurvy is caused by the deficiency of vitamin C, and that will give us weak bones, brittle bones. Hormones are needed for good bone growth. During puberty and childhood, we need growth hormones, which stimulate the growth of bones and cartilage. So it stimulates interstitial and appositional growth. Thyroid hormone is needed for the proper functioning of growth hormone. We also need estrogen and progesterone and testosterone, especially at puberty. So these sex hormones at puberty are going to stimulate osteoblast activity, causing the rapid growth that we see at puberty. Estrogen triggers quicker response from osteoblast than testosterone, and that's why females finish their growth earlier, because estrogen is a stronger stimulation, it causes a stronger stimulation of osteoblast activity. Abnormal conditions of growth hormone before puberty could cause gigantism, which is excessive growth of bones in length, or dwarfism in the case of a lack of sex hormones before puberty. So we have already talked about remodeling of bone, and that is the process that shapes bones, is going to repair bones that have broken, etc. Remodeling follows the stress, the mechanical stress that we put in the bone, so that bone is constantly being moved by osteoclasts and formed by osteoblasts. Osteoblasts are responding to the mechanical stress that we're putting on the bone. Mechanical stress stimulates osteoblast activity. So in the places where there is more stress, the bone will become thicker. In places where there is less stress, osteoclasts will eat up the bone and the bone will become thinner. Okay, so that's how bone is modeled into its shape. So stress, mechanical stress, causes remodeling to increase bone mass. We're using certain areas, and to align the trabeculae in the direction of the stress. So when we're talking about stress, we're talking about mechanical stress. So that again has to do with repair of bone. When bone breaks, it is vascular tissue, so there will be a hematoma, there will be bleeding formed and a hematoma formed. That will be the first stage. Then macrophages will come in and eat up the debris, clean it up, and a hyaline cartilage model of the bone will be formed to seal the broken pieces. That's going to be called the callus. So this will be the formation of the callus, the cartilage callus. Then the osteoblasts will begin to form bone tissue, and now we have a calcified callus, which needs to be remodeled by osteoclasts according to how we're using the bone. So the bone remodeling will take place thanks to the activity of osteoclasts responding on how we use the bone. The whole process will take several months to happen. Okay. So you should know what happens during the repair of broken bones. You should know what a callus is, that hematoma formed, and the role of osteoblasts and osteoclasts in the repair of the bone tissue. Now, calcium bones store calcium, and calcium is needed for the activity of other systems like the muscular system or the heart, for example, or the nervous system for that matter too. So blood needs to have a normal concentration of calcium at all times. Since bone is the storage of calcium, if blood calcium levels go down, then calcium needs to be taken from the bone to replenish the calcium in the blood. By the same token, if blood calcium is too high, calcium is taken from the blood and deposited into the bone. So these calcium homeostasis is due to the action of hormones, specifically parathyroid hormone and calcitonin. You should definitely know what these hormones do. PTH, or parathyroid hormone, is secreted by the parathyroid gland, and what it does is it's going to increase blood calcium levels. So when we have low blood calcium, that triggers the production of PTH. PTH is going to stimulate osteoclast activity. Osteoclasts break down bone tissue, and the broken down calcium will be secreted into the blood, increasing blood calcium levels. So PTH is going to stimulate osteoclast activity. PTH is also going to promote the production of vitamin D so that we get more calcium from foods. It's also going to prevent the loss of calcium through the kidneys via urine. So it's going to take calcium that has been filtered out of the blood into the urine and put it back into the blood. All these three processes are going to increase blood calcium levels. So PTH will take calcium from the bone and put it into the blood by stimulating osteoclast activity. PTH is going to increase production of vitamin D so that we can absorb more calcium from the foods into the blood. And then PTH is going to trap the calcium that is filtered is about to be secreted into the urine and put it back into the blood. Calcitonin is the antagonist of PTH. Calcitonin is secreted by the thyroid gland and is going to cause the decrease of blood calcium levels. So calcitonin is going to promote osteoblast activity. So if we have high blood calcium levels, higher than normal, the body will secrete calcitonin. Calcitonin will stimulate osteoblasts into taking some of that calcium and putting it into bone. And that's going to cause a decrease in blood calcium levels. Okay? So you should definitely know the effects of PTH and and calcitonin. The effects of aging in bone, well, bone matrix is going to decrease. There's going to be a lack of collagen, a lack of hydroxyapatite crystals. Bone mass begins to decrease at the age of 30 and will continue on as we age. The smaller we are, the more mass we're going to lose. So weight-bearing exercise is especially important if you're a small person. The greater the weight, the stronger the bone, because the more stress is being put in the bone. In women after menopause, the rate of bone loss increases tenfold. So there's a dramatic loss in bone tissue. So osteoporosis is the condition in which bone tissue becomes very thin and brittle due to the lack of calcium and collagen. This happens especially in women. 80% of the osteoporosis patients are women, and that is because of lack of estrogen after menopause. So the hormone that was stimulating growth or bone production has diminished. Also, more difficulty making vitamin D, less calcium. Women are, if they're petite, that's even worse. Women have smaller muscles. So smaller muscles means less mechanical stress, which means less muscle mass. Immobility is also another cause of osteoporosis. Diabetes mellitus would be another one. So those are the risk factors for osteoporosis. Here's a view of osteoporotic bone, dramatically different from healthy bone. So what can we do about it? Well, treatment and prevention, taking calcium and vitamin D supplements, increasing weight-bearing exercises throughout life, sometimes hormonal replacement therapy, and then some drugs. And what these drugs are going to do is they're going to inhibit osteoclast activity. By inhibiting osteoclasts, we give a chance for osteoblast to build bone. So you should definitely know what happens at osteoporosis, what are some of the risk factors, and how can osteoporosis be prevented. Bone fractures, there are two types of bone fractures. If the bone fracture opens the skin, we call it a compound or open fracture. If the fracture doesn't close the skin, then we call it a simple or closed fracture. An incomplete fracture is one that doesn't break the bone across, but just partially breaks it. A complete fracture breaks the bone completely across. This is an example of an incomplete fracture. It's called a green stick fracture. This is common in children. Notice how the bone has bend, which is a bendable bone, is typical of a young bone. So pressure has been put in one direction, and the bone bends and partially breaks. A green stick fracture is common in young children. A hairline fracture is a small fracture in a bone. This is due to some type of blunt trauma, and that is common in the skull. A comminuted fraction happens when the bone breaks into tiny pieces. This is common in all elderly patients that have brittle bones. Okay, so that is the end of the chapter. If you have any questions, we can address. Otherwise, I'm going to schedule another session for chapter 7, which will be not very long because chapter 7 is actually a very short chapter. And that should be it for this next module. Okay, so if there are no questions, I'll go ahead and stop the recording.